next session. I'm really delighted to introduce a fantastic colleague, Dr. Jess Heron, who's Chief Executive for Postpartum Psychosis. Our second member of the panel is Sarah Douglas, who's the Principal Clinical Psychologist in Heron, Bevan, Specialist Perinatal Mental Health Service. And Emma Morgan is our third member of the panel, who's a health visitor based in Abercunning, and I think is Sharon joining the panel as well. Did I hear?
I will, but I'll let the other. I'm sure the others have much more important things to say.
Fantastic, Sharon. Great to have you on the panel as well. So I've got some questions, and again, please add any questions that you've got for our panel to the Q&A tab specifically. First question: what difference has the unit made to parent and babies across Wales? Jess, perhaps we'll go to you first for that one.
Yeah, I think as we've heard already really powerfully today, a mother and baby unit is an essential service, not a luxury for women with severe postnatal illness. APP's research has showed that women that come out of mother and baby units feel more satisfied, they recover quicker, they feel safer, they feel more informed about their illness, confident in their staff. They feel more recovered on discharge and more confident with their baby. And our qualitative work in APP as well shows that women who aren't admitted to a mother and baby unit hold feelings of anger and trauma for a long time afterwards, which is why I think that APP built a really strong team of volunteers and women with lived experience across Wales who are willing to share their powerful lived experience stories and radio, TV, print, social media, at events and to influencers to show just how important a mother and baby unit is, and that it's not okay for women with newborns to be admitted to general units separated from their babies, or to travel long distances to England. So it's really wonderful that women across South Wales have access to this kind of world-leading, therapeutically appropriate care for new mums.
Thanks, Jess. That's fantastic. Sarah, have you got any thoughts yourself on the difference the unit is making?
Yes, well, I guess I get to hear it directly from the mums that come back to us afterwards, and it's been hugely beneficial having a unit in Wales. We've had mums go to MBUs before, but the sell was a lot harder back then to get people to go to a unit elsewhere. I think partly that's because of the distance, and partly because it's also an unknown for us. We don't have the relationships with those units in England. Whereas I think we feel really confident in sort of recommending Uned Gobaith because we know the staff, we know what they're going to get when they get there. And the difference it's made to our mums has been absolutely huge. And yeah, all the mums that I've spoken to have just been hugely complimentary on the compassionate, thoughtful care that they've had on the unit. And I guess what I notice is that it really kickstarts recovery. So we might be in the community kind of working as best we can within the resources that we've got, making kind of slow change, but on the unit they have this intensive involvement, and it really kind of kickstart that recovery, which means when they come back to us we can kind of carry on that care, and yeah, their journey to recovery is just that much quicker. So yeah, just congratulations to everyone because you're doing a fab job.
That's fantastic, Sarah, to hear those positive reports. Emma, from the perspective of health visiting, what would you say is the difference is being made?
Well, I suppose I've been fortunate enough to have worked with mothers and babies my whole career. So I started off in a local maternity ward as a nursery nurse, then qualified as a paediatric nurse, and went on to work in neonates. So throughout this time, it then became apparent that mother and baby units were not available for mothers experiencing mental health issues. So I suppose the biggie for me was that it meant mothers travelling to England and this being such a barrier for them, but also for their families as well, to see families being left sort of anxious and scared and just the travelling, isn't it? And hopefully now this new unit will alleviate any of these anxieties which are felt. I suppose for us during the antenatal period is the perfect opportunity to screen for any mental health issues. And this contact is vital really to identify and build trusting relationships. This is a mandatory part, isn't it, of the Healthy Child Wales programme, but it allows for any discussions around mental health when assessing and interventions are needed, to be able to sometimes have difficult and sensitive conversations, knowing really us as health visitors that we've got a clear direction of support that's available to empower mothers for them to have their babies with them and for them to be actively involved in the care that they might be receiving. So I was really, really fortunate and had the privilege to work with one of the first mother and babies that was in the process of entering the unit in Tonna, and the experience was amazing from both sides really. From the health visitors' perspective, the communication in the unit was seamless. They updated me every available opportunity, even if I sort of like banged out an email or sent a message to Joe's, the health visitor there. She just got back to me straight away. So this was really priceless because it meant I could provide reassurance to the dad. And also when we did have multidisciplinary meetings, I could support other family members as well. So yeah, it's all very positive from my part.
Excellent, thank you, Emma. Sharon, I'm sure you're delighted to hear those positive accounts from Emma, from Sarah, and from Jess. Have you got anything to add on that particular issue about the benefits that already are coming? Well, Sharon, I think you're on mute. Good job, it's not just me.
Yeah, it's got to be two of us, Ian, sorry. I think for the women, it's just made sure that we're providing that right care and at the right time and by the right people, and it's closer to home, which is absolutely essential for the staff. Wales is small enough, isn't it, that we can develop those amazing relationships, not just with the specialist team, but with other mental health services and colleagues that can refer into the unit. The staff know now that they can call, they can chat, and they can sound things over because the staff are always there and are incredibly supportive and are able to support our colleagues within the community to hold maybe when an admission isn't right at that point in time.
Excellent, thanks, Sarah. Thanks, Sharon. Sarah, really important question for you, I think, is how crucial is partnership working between the MBU and the wider perinatal network, including community-based services and women and their families? What are your thoughts on that question?
Yeah, it's absolutely crucial, and I think the unit have done a really good job at kind of building those partnerships with all the specialist teams. So I know that we always get, when we've got one of our ladies on the unit, we always get an invite to those weekly meetings. And we'll always make sure that somebody attends that. So I've been to one of those meetings, and it's so when you're at the meeting, you get the whole team, so you get the whole multidisciplinary perspective on that client, which is so very helpful. And then I think the other thing that I know the unit is working really hard at, and my natural connection with as a psychologist with Matt as the psychologist on the unit, is about that transfer, because we all know that, you know, it can be a very containing time being on a unit, but that time of transferring back into the community can be a kind of a really risky time for relapse for mums. So I know that me and Matt have a lot of conversations about mums that are coming back to us thinking about what Matt's done, what we can then do from psychology, kind of moving forward. And I know the same happens with other kind of disciplines as well. I know our OT in our team has really good links to the OT on the unit. So I think that transfer of care is really vital to ensure that we have a kind of a successful time back in the community and try and prevent those repeat admissions. And it was really lovely to see the figures actually that haven't been that many repeat admissions, which I think means that something's working. I'm sure there's always room for improvement, but I think we've made a really good start with that. And I think it really helped. And I think kind of going back to it being, it's a Welsh unit. And I think those Welsh, we are small, as Sharon was saying. And I think those Welsh connections are so important. You know, we might get to know each other through admissions, our colleagues on the unit, but also through all the other meetings that we attend, the community of practice. So all those connections, I think, just means that we can do such a better job for the families that we're supporting. So yeah, absolutely crucial, that collaborative working.
Excellent, thanks, Sarah. Sharon, have you got any thoughts? Sarah mentioned the community of practice. How is that partnership working being supported more widely across Wales to ensure that there are no gaps that the women and their families fall through?
Yeah, the partnership working relationships, connections are absolutely key and priority within the Wales Perinatal Mental Health Network. So we've invested a lot of time and energy building up, identifying who's involved or should be involved, engaging and connecting with them, setting up or rebooting the community of practice. But we also have clinical network steering groups, and we have a number of service forums where we're bringing colleagues from the same service areas together on a regular basis. And yeah, it's absolutely key, isn't it? It's small enough. We are so fortunate that people get, know each other, or we can connect lots of pieces of work, share best practice, think about challenges, safe spaces for people to talk. So yeah, it's definitely a focus for the network.
Fantastic. Emma, you've already talked about the importance of working with health visiting. Any further thoughts about how this partnership working is so key?
I suppose it's about sharing our experiences, isn't it, with the colleagues that we work with. I think that's where we sort of learn from, really, knowing what services are out there, so that they can then go forward and they can perhaps use the unit in Tonner as well. It's about the awareness, creating awareness.
Excellent, thanks, Emma. And Jess, I'm not going to move on from this question without giving you the opportunity to, I'm sure, emphasise that partnerships that are important here, and not just with the health service, and other statutory services, but with third sector organisations as well. And I'm sure you've something to say about the fantastic work that APP do in linking in with MBUs, not just in Wales but across the UK.
Yeah, I mean, I think from the very start, the setup of this unit has been a real model of collaboration and partnership working with APP and other third sector organisations. So our women with lived experience have been involved in not only the campaigning for the unit, but the planning, design, choosing artwork, thinking about care pathways, right through to the induction and training of staff, and raising awareness about the unit across the community as well, both to health professionals and the general public. Women and families need to know that the unit is there and is there to support them. I think that working really closely with the community and with third sector organisations is so important in thinking about long-term peer support, long-term well-being of women and families as they recover, because as everyone knows, postnatal illness isn't just something that happens and then women get better. It does continue to affect women's and families' lives for a long time to come. I think that the continuity of care as women go home is really important, and it's important that the peer support that's provided in the unit can carry on and can have longevity at home, and vice versa. The support that's there in the community as women get admitted to the unit, it's really important that that can continue as well. And I guess, again, really importantly, it's that we all work together to raise awareness of this as a fantastic service that can support everyone that needs it, but also so the public and our MPs really value mother and baby units and know exactly why they should exist.
Excellent, Jess, and massive thanks to the work that APP do in this space. It's absolutely amazing. So we're going to have to move on in a few minutes, but I'm going to give one final question to the panel, and perhaps go to you, Emma, first on this one. And the question is, what are the challenges still facing women and their families accessing specialist inpatient care in across Wales? And maybe some thoughts about, we asked our previous panel of speakers some thoughts about where they saw things going in the future. Where would you like to see things develop? Emma, let's go to you first.
I suppose really, again, going with the footprint of the unit, and we need to expand out to other areas. That could possibly be a limitation to the service that could be found. Also as well, some mothers may be so scared about entering the unit when they've delivered, it could possibly be an idea for them to visit during the antenatal period, just for this, any anxieties which are felt could be alleviated.
Excellent. Thanks, Emma, for those thoughts. Jess, should we go to you next? What are your thoughts about the challenges that remain and the direction of travel?
Yeah, I mean, I think we've already talked about the North Wales unit and getting a rapid time frame to stop the negative consequences of there not being a mother and baby unit, or women having to travel a long way from home, which I think is particularly important as well for single parents who, you know, the consequences are not only trauma and isolation, but they can, you know, end in battles for custody. And when we're thinking about women's narratives, women taking the decision not to be the primary caregiver, you know, when that could have been prevented if a mother and baby unit was available to those women in North Wales. I guess the other thing is really in making sure there's always more connection to do, always more embedding. So really embedding the unit in the community in terms of supporting partners, accessing peer support for partners, grandparents. And I think that we also know that severe postnatal illness affects women from all backgrounds. And we know that there are certain groups of women who are less likely to be able to access support: women from Black, Asian, other ethnic minority backgrounds, women from lower socioeconomic groups, and those facing multiple disadvantage. And I think it's really important that we continue with awareness raising and outreach work specifically to try and facilitate and remove the barriers to those groups of women as well.
Thanks, Jess. Sarah, challenges and direction of travel, what are your thoughts?
I'd agree with everything Jess and Emma are saying already, that, you know, I think there still is, there's still challenges in terms of kind of distance for a lot of families. And as kind of Jess was saying, I think we need to better understand kind of what gets in the way of someone making that decision to accept a place on a mother and baby unit. And I think I just saw popping up in the chat, Jane mentioning about, you know, we've got kind of, we've got sort of air ambulances for physical health problems. So, you know, do we need to think broadly about how we can help transport mums and families to units, and kind of think outside the box so that, you know, we can increase access. We've certainly had challenges at times, you know, limited times getting mums a place on the unit. So we know that there aren't always enough beds for everybody. I mean, they do work really hard to try and give someone a place as soon as there is a bed available if someone is elsewhere, but I think that is still a challenge. And as Jess was saying, that, you know, the absence of a unit in the north, and I think some people have been putting in the chat absence in, you know, mid Wales even, you know, it's a really long journey for a lot of people. And I think having that named unit that, you know, is almost yours, you know, I think we feel an ownership, you know, the MBU is part of what we offer in an Iron Bevan, you know, it feels like our unit that we use. And I think having those relationships is so important, rather than just finding whatever unit is available. I do wonder moving forward about the age limit. I think it's come up in our service about the age limit, but we've always had very thoughtful discussions around that. But I know there's a push in the specialist teams that we expand beyond 12 months. So we often talk about the first 1,000 days, and we know that our MBU doesn't match that. Our specialist teams, as a rule, don't tend to match that. So I think we've got those challenges to face moving forward for both the community and the MBU. And I think it's just broadening the offer, what's available. It's lovely to hear Matt talking about thinking about kind of peer mentors. We know how well they've worked for us in an Iron Bev, and I think Barbara, one of our peer mentors, is here today. And just having that ability to kind of share that lived experience, say, I've been there, I know what it's like, and this is where you can get to. And I think having that provision on the unit, as well as, yeah, more psychology, you know, Matt's only part-time on the unit. We could do with Matt every day of the week, and probably lots of other psychologists and psychological therapists and lots of other professions on the unit as well. So I think there's loads of room and scope to grow. But yeah, I'll leave it there.
Fantastic, Sarah. That's some fantastic thoughts there. And Sharon, I'm going to give the last word to you as our clinical lead. When are we getting our specialist perinatal helicopter? Yeah, is that on the cards? Huge thanks to you for all the work that you put, the tireless work that you've done on services. So I just wanted to say that, but I'll give the last thought on challenges and directions of travel to you.
Thank you, Ian. You know that my reputation, I can be persistent and a pain, so I'll start on the ambulance now and we'll see how long it takes us. I think, you know, Emma, absolutely. It casts my mind back to my days as a sick children's nurse. We used to have children visiting the ward prior. You know, that would be great to think about. And I think it's in the making, isn't it, a video that we can put online and people can and see what the unit's like and how it functions. You know, absolutely agree with everybody else. The need maybe for more beds, the geographical distance, I think in Wales will always be a challenge wherever we have units, unfortunately. We've had a number of conversations around the first 1,000 days, not suggesting for 1 minute it's the unit, but just thinking about the needs of those that have siblings over one or children over one. Partners, families and siblings, definitely in everybody's mind. That's been talked about today. And I think this event is really helpful, but I think there's definitely more work to do around increasing awareness and making sure all our colleagues in Wales know that this unit's available and who can go into the unit, so we're making sure that everybody's getting the care or offered the care they need when they need it. So yeah, Ian, that's from me.
Excellent. Thanks to Sharon. Thanks to all the panel for that excellent discussion.